the most important thing I wanted to share was that the best way you can help us further the research is by disseminating the information about the fact that finally this study may get underway in the next few months. The federal government is where we have to purchase marijuana study drug, and they finally learned, after 14 months of waiting, they finally learned how to grow marijuana for this study, and they've notified us that they may have study drug ready for us in the next few months. So that means that we're going to be screening hundreds of military veterans over the next, over the summer, to try to find those optimal 78 vets that meet all of the pages and pages of inclusion and exclusion criteria in order to get enrolled in this. So the best way you can help is just arming yourself with information about the study, sharing the contact info about how they can be screened. I'm sure we'll be advertising an 800 number, an email, and things like that. One of the other things that we really need is access to the Phoenix VA, and many of you are aware that the Phoenix VA hospital has blocked us from educating their medical staff about our research. So we've asked over and over again to do a simple grand rounds lecture for the medical staff. It's crucial because we need patient referrals from that team, and the VA medical staff wants to know about it. They're hungry to learn about research like this and possibly send select patients to be screened, but the VA administration will not allow it, and that is shameful. When we see information suppression and curbing of scientific freedom, we should all be outraged by that, and please, whatever you can do, the veterans who are in the room, to contact the Phoenix VA hospital and demand that they allow us access to promote, to provide a simple lecture about the study design and let them know how they can participate. The other thing real quick I wanted to let you know is there's a group of veterans who took the initiative to organize an awareness campaign about the epidemic of veteran suicide. And rather than do a ribbon campaign, they chose to use dog tags and engrave the number 22 in these tags so that people, this is the number that came out of the VA administration back in 2014, where they admitted that 22 veterans a day were killing themselves in this country. And everybody who studied this subject acknowledges this number is a very low estimate. I can tell you in my own practice, I've lost many veterans to suicide, but they were all labeled accidents. And the data, 22 a day, doesn't take into account all of the states. I think there were only 20-something states that reported. So this number is probably falsely low, but it's still a horrific number. And for those of you who want, I have some dog tags up here. If anybody wants them, please grab them. There's a website they created called 22hope.com where you can pick up more of these and spread the word. It's just an awareness campaign